good morning, ma'am. Good morning, ma'am. I'm Jessica Valdez, and I will be going to perform the written demonstration for administering nasal medications. So the purposes of this procedure po is for astringent effect, to shrink swollen mucous membranes, also to loosen secretions and facilitate drainage, and lastly is to treat infections of the nasal cavity or our sinuses po. So the most common is our nasal decongestants po. So for our assessment, we need to assess for the following: client's level of consciousness and ability to understand instructions po. So how are you, ma'am?
Okay naman po.
Okay po, that's good to hear po. And also our client's vital signs. Theoretically po, I've got already the client's respiratory rate, blood pressure, pulse rate, and our temperature, and all the results are all normal po. So also for the presence of nasal discharges, so may I inspect po. So yan po. And then the presence of nasal irritations. So meron po ba kayong nasal irritations po, ma'am?
Wala.
Okay po, wala naman po. So also the intactness of our medication. So intact naman po siya. The color and appearance of our medication, and the expiration date of our medication. So the color of our medication is normal naman po. The expiration date po is 2025. And then also the presence of nasal congestions po. So meron po ba kayo nun, ma'am? Wala naman po. That's good po. And then for our planning, we need to observe the 12 rights of giving medication, especially the 6 rights of medication, which are the right client, right medication, right route, right dose, right time, and right documentation. And then do hand washing before and after the preparation of our materials. And then prepare the following equipment, which is our hypo tray, and then our prescribed medication, and then our medication card, which says sodium chloride muconase, and then one spray for both sides of the patient's nostrils po. Okay po. And then also our sterile gauze po, and then our nandun po sa gilid yung ating garbage bag po. Next is to do hand washing. So after po natin nag-prepare ng materials po. Ayan. For our implementation procedure po, ayan, nakapag-perform na po tayo ng hand hygiene and put on PPF indicated po. Ayan. So next is to identify your client's identity using two identifiers and introduce yourself. So, I'm Jessica Valdez po, your nurse for today. May I know your name, ma'am?
Ruby Rose M. Medicrito.
Okay po. Your birthday po?
January 27.
Okay, that's good po, ma'am. So, I will be going to administer a nasal medication po based po sa prescription po ng ating physician. And I will be going to ask you to do some tasks for me. Please do follow my instructions well. Is that okay po?
Opo.
Okay po, that's good po. And then, place the also the rationale behind this is that this ensures that the right client receives the medication po. So next is to place the hypo tray on the bedside table and provide for the client's safety, comfort, and privacy. So first is the proper positioning po ng ating patient, in which can be side lying position, supine, or sitting. So saan po kayo mas comfortable, ma'am?
Dito na.
Okay po, so sitting position na daw po. And then putting the side rails po theoretically where we will work in a clinical setting, and keep the other side rails upward. And then spread the curtains po. Ayan. So for our to secure the patient's privacy and safety po during and after the procedure po ng ating medication. And then placing the call light where we will work, in which the client can reach po. And then put down the side rails where we will work. And then assist the client in a sitting position. So, comfortable naman po kayo. How about the temperature po ng room? Okay naman po. Hindi po masyadong mainit, ma'am. Ayan, so okay lang daw po. And then put on clean gloves. And then next po is to offer gauze. Iboblow po ng ating patient yung kanyang nose to dispose any discharges on her nose po. And then dispose the gauze in the garbage bag. And kuha lang po kayo. Sige po, singan nyo lang po. Dispose po natin. And then next po is to assume supine position and with the head tilted back po. So hold the tip of the container and just inside the ears po and instruct client to inhale as we spray as the spray enters the nasal passageway po. However, on children naman po, medications are given in upright position so that to prevent excess spray from being swallowed po. So, assist the patient po for the administering po for our medication. Ayan po. So, okay na po kayo sa sitting position niya, ma'am. Yan po kayo comfortable. Ayan. So, hold nyo po yon and then tingala po kayo. And then, dahan-dahan pong baba. Baba po. So, 1. Spray ko na po. 1, 2. Inhale nyo po siya after kung may spray. 1, 2, 3. And then, okay na po. And then, sa kabila naman po, tingala po muna. Mababa na po. Ayan. So, 1, 2, 3. Spray ko na po. Inhale nyo po. Ayan. Okay na po. And then next is to assist the patient in a comfortable position and secure the side rails po. So, okay na po kayo sa ganyang position. And then, raise the side rails po upward so that we can secure the patient's safety, and then dispose all used materials and rearrange the reusable one. And then next po is to remove the gloves and PPE if used, and then don't forget to perform hand hygiene. Dispose na po natin. And then, assess for the effectiveness of the medication given. So, given time frame po natin is 30 minutes. And then, don't forget to document the administration of the medication done immediately on the client's chart or record, including the patient's response to a given medication po. Yan, so the medication is given nasal. And then, okay na rin po. And then next is to evaluate the patient's response to medication within a given or appropriate time frame. So, thank you po.